Now, a couple things too. Oh, and also, how many of you hate math? Just kind of cute, be honest. Okay. Don't delay your math because that's another area that could really keep you from transferring. So do it as early as possible. Statistics is typically the math that you need. Now, one of the things that you need to do, how many people have gone to any of the pre-nursing advising meetings that are offered by the universities? How many people have never ever heard of them? Okay, that's kind of what I figured. So let me give you an example of what you need to do. Here's an example of Cal State East Bay's nursing website. So all of the schools that you are considering, you need to make sure that you go to the nursing website because that will be how you know if the recency is 7 years, or 8 years, or 5 years. And it can change. Because what happens is the nursing faculty of that department, they're the ones that decide what the requirements are. And it changes because they're getting so many applications. Some departments are getting as many as 800. So if you're getting 800 applications for 25 spots, then how do you determine who gets those spots? And it's through the nursing department websites that will tell you that. So if you look here, you will see, for example, you would be considered pre-licensure. So for fall 2010, if you click on that link, what happens is Cal State East Bay is telling you what they're looking for. You will notice that for the CSUs, this is pretty standard. You have to apply with 2 applications for nursing. You have to apply to the university first. So that's usually through CSU Mentor, which is the university website for the whole system. And then you have to apply to each individual nursing program. Some of them have online forms, some of them have paper copies that you download off the website. And usually the nice thing about nursing departments is they are very upfront. There's no secrets. They tell you exactly what they're looking for. I mean, the demand is such they don't have to. They're telling you to be admitted, you have to have at least a 3.0. They're also telling you that you have to have your 60 semester units, your 9 prerequisite courses, and then your 5 prerequisite science courses. What you'll notice when you read, for example, Cal State East Bay, the prerequisite courses for nursing, and what I mean is like anatomy, physiology, microbes, statistics, all of those, has to be done the fall semester for a fall transfer. Okay, so think about that for a minute. We're in fall 2009. Let's say you want to get into this program for fall 2010, so that's a year from now. Your prerequisites for nursing have to be finished this semester. So even though you have spring left, it has to be done a year in advance because they want to see those grades. You can do general ed in the spring, but the prerequisites for nursing have to be done for this department fall. If you look at San Francisco State, I think they allow 1 in progress in the spring. Each department is different, so you need to read this constantly because you need to be able to plan out your courses so you're done. My recommendation, get all your prerequisites done in that fall. And that way you don't have to stress about, gee, what happens if, I don't pass that one in the spring. You know up front what your GPA is, you know that you've done it, and use this last semester for general ed. So we'll talk some more about strategies, but I wanted to point out those advising sessions. Every single nursing department that I've seen has this. So for Cal State East Bay, see where it says General Advising Sessions? When you click on this link, lo and behold, they had one yesterday. Okay, so they have 2 programs. So actually for this campus, you can apply to the Concord Nursing Program. You can also apply to the Hayward Main campus. These information sessions are set to be able to tell you what you need to do to get in. So they will tell you what's required if they use a lottery system, if they use a point system. So sometimes they'll give you point for GPA, points for overall GPA, points for science-based GPA, points for experience in a healthcare field, points for having or being able to speak another language. So on the website, it will tell you what you need. These advising sessions are free. They will tell you their selection process. If you bring your transcripts, oftentimes they will actually review your transcripts. So make sure you bring all of them. So if you've attended more than DVC, and remember that even if you've attended our sister campuses, LMC and CCC, bring those transcripts too. Have all your questions written down. What I recommend, there's so many of you, is that you really pool your resources. So all of you that are interested in Cal State eSpace, send a representative here to bring back your information. Send someone else to San Francisco State, send someone else to USF, and then bring it back to your club to share that information instead of you going to 10 different ones. So think about doing that. These information sessions, it's actually the nursing department that's there. So they're the ones that will be explaining what you need to do. They will explain any extra things that you can do to help kind of expedite. So if you go to each of the websites, whether it's Sac State, whether it's Contra Costa College, whether it's LMC, whether it's San Francisco State, they almost all have these advising sessions. And so you should put it on your calendar and plan to go. Okay, any questions on that so far? Okay, so let me just kind of go back to this website real quick, and I'll continue on. Okay, so what will happen is they'll tell you, for example, Cal State East Bay, they will tell you that you have to have at least a C grade. They will tell you minimum GPA. Okay, now, there's different types of GPAs. There's minimum, and there's competitive. Minimum is what you need to actually apply. Competitive is all the other people that are applying the same year that you're applying. So San Francisco State has said one time that their average GPA was 4.0 for every single person that got in. Does that always happen? No, that's pretty rare. But you want to know up front. Okay, so in addition to coursework, if you are not knowledgeable, you will see that in Cal State eSpace, they want you to have healthcare experience. So what does that mean? It means that you need to go out and you need to do some volunteer work. So especially for those of you that are at the beginning, and you really haven't got deep into like the anatomy, physiology, that's a really good time when you're working on GE to go out and get volunteer work.
Out there it says your work must be paid, not volunteer.
That's an optional. Yeah, that's an optional. So for some people, you'll find that folks work in the healthcare industry anyway. Let's say they're an ultrasound technician, for example, now they want to go into nursing. Then that would give them sort of a leg up because they have experience in the field. See, going back to the economy issue, there are a lot of people that I know who tell me they want to go into a nursing program, but they're not really interested in becoming a nurse. They're interested in job security. So in this economy, when people are getting laid off and so many industries are struggling, they're looking at where can I get a job where it has pretty much almost guaranteed longevity, a lot of flexibility, and a salary that can support living in the Bay Area. So nursing comes to mind. So they want to make sure that you actually want to be a nurse. And so they want to make sure that you have experience.
Is veterinary or something?
It's probably not exactly what they're thinking of. Now, when I think about usually how I advise students is, to kind of improve your chances, cast a wide net. So in other words, volunteer at a hospital, maybe volunteer at a nursing home, maybe volunteer at a clinic, so that you show a variety of experiences. And if you can work it out with a variety of populations,